My name is John Conley. I'm a professor in the Materials and Devices group in EECS. And I'm going to talk about an implantable device that in principle could be hooked up wirelessly to the Internet of Things. And so about 2 million people in the US suffer from type 1 diabetes, and these folks are required to monitor their blood sugar. And the consequences of uncontrolled blood sugar are pretty severe and can include blindness, kidney failure, and even amputation. There is some technology, so it's been shown that continuously monitoring glucose in your bloodstream and with an integrated insulin pump can very well control the insulin or the glucose levels and reduce the risk of these complications. However, the state-of-the-art systems require 2 to 4 insertion points, and a lot of patients just don't like having to deal with that, and therefore only about 5% of the people with this condition actually use the state-of-the-art technology. And so in collaboration with Pacific Diabetes Technologies, we've developed a flexible glucose sensor, which consists of indicating electrodes and common electrodes in the image in the middle there on a flexible polyimide substrate. The engineers up there have wrapped it around a catheter shown on the bottom. And then in the top, you can see that there's it's hollow there. And so by monitoring glucose on the outside of this needle and injecting insulin through the middle of the needle, they're able to control blood sugar. And this system has already been used to test glucose levels in pigs on campus here, actually. Don't ask me about what type of pigs those are. But they found that there's essentially no consequence of introducing the insulin at the point of glucose detection. And so you can see there's a plot of glucose versus time for a catheter that's injecting insulin and one that's not. And so that's kind of the first stage of this. And it's very promising results so far. And the eventual goal here is to combine both insulin and glucagon delivery into a single catheter device, so the patient would have one insertion point and basically improve the lifestyle for those living with this disease. And this is just one of the many projects going on at the Materials Synthesis and Characterization Facility at OSU. And later on this afternoon, we can tell you, and some of the other faculty members can tell you about some more of them. Thank you.